Hey guys, welcome to another episode of the Human AI podcast. Today we're going to talk about how the cardiovascular system fails. I'm here with Krok, an AI. Is going to be explaining to us these concepts, this topic. I hope you find this video informative and enjoyable and take everything that AI says with a pinch of salt, do proper science and make sure you cross-reference everything you hear. Nevertheless, Krok, let's get on with today's topic. So, what does it mean for the cardiovascular system to fail? And how does the cardiovascular system fail, Krok?
The cardiovascular system fails when the heart or blood vessels can't effectively deliver oxygen-rich blood to the body, leading to inadequate tissue perfusion and organ dysfunction. It typically happens through conditions like heart failure, where the heart can't pump enough blood, often due to weakened heart muscle from coronary artery disease, high blood pressure, or heart attacks. Other failures include arrhythmias disrupting heart rhythm, blood vessel blockages like atherosclerosis, or valve issues causing inefficient blood flow. These problems reduce oxygen delivery, build up waste, and strain organs, potentially leading to symptoms like fatigue, swelling, or even organ failure if untreated. Want me to dive into a specific cause?
Well, let's talk a bit, let's start a bit about talking about stroke. So, what's a stroke? What kinds of stroke do we have? We have hemorrhagic and ischemic. Explain what that means.
A stroke happens when blood flow to part of the brain is disrupted, causing brain cells to die due to lack of oxygen and nutrients. There are two main types, ischemic and hemorrhagic. Ischemic stroke, the most common, occurs when a blood clot or plaque blocks a brain artery, cutting off blood supply. Hemorrhagic stroke happens when a blood vessel in the brain ruptures, causing bleeding into or around the brain, which damages tissue and increases pressure. Both types impair brain function, leading to symptoms like sudden weakness, speech issues, or paralysis, depending on the affected area. Want me to focus on one type or their effects?
Well, yeah, what would make, let's say, what would cause a vessel rupture to have a hemorrhagic stroke? What kind of stresses? Talk to me about blood pressure. Talk to me about turbulent flow, tension, damage, atherosclerosis.
A hemorrhagic stroke happens when a brain blood vessel ruptures, often due to excessive stress on the vessel wall. High blood pressure, or hypertension, is the leading cause, as it puts constant strain on vessel walls, weakening them over time until they burst. Atherosclerosis can contribute by causing plaques that make vessels brittle or narrow, increasing pressure and rupture risk. Turbulent blood flow, often from narrowed or irregular vessels, creates additional stress by causing uneven force on the walls, potentially leading to tears. Physical damage, like trauma, or inherent vessel weaknesses, such as aneurysms, can also trigger ruptures, especially under high pressure or inflammation. These factors combine to compromise vessel integrity, leading to bleeding in the brain. Want me to zoom in on any of these causes or their effects?
Well, let's talk about tension, for instance. So, what is tension?
Tension in blood vessels refers to the mechanical stress or force exerted on the vessel walls, primarily due to blood pressure pushing against them. It's like the stretching force in a balloon as it's inflated. High blood pressure increases tension, straining the walls. In the context of hemorrhagic stroke, excessive tension can weaken vessel walls, especially if they're already compromised by conditions like hypertension or atherosclerosis.
But what is tension? Is it a force? What is it?
Tension is the force per unit area exerted on the walls of blood vessels by the pressure of blood pushing outward, stretching the walls like a taut rubber band.
So what's the difference between pressure and tension?
Pressure is the force per unit area exerted by blood pushing against the inner walls of blood vessels, like air pressing inside a balloon. Tension, on the other hand, is the resulting stress or stretching force within the vessel wall itself.
Can you explain it a bit more simply? Because you are giving very precise, good definitions, but I don't understand them.
All right, let's make it super simple. Pressure is the push of blood against the inside of a blood vessel, like how water pushes against a hose. Tension is how much the vessel wall stretches to hold that push without breaking, like the stretchiness of a balloon when you blow air into it.
So is it the counter force of the pressure?
Yeah, exactly. Tension is like the counterforce in the vessel wall, fighting against the blood pressure pushing outward. The pressure tries to expand the vessel, and tension is the wall's resistance, stretching to hold everything in without bursting. If the pressure gets too high, the tension can become too much.
And why does something stretch? What is it? What in the chemistry changes for it to be able to stretch?
All right, let's break down why blood vessel walls stretch and the chemistry behind it. Blood vessels stretch because their walls contain elastic tissues, mainly elastin and collagen, which act like rubber bands and scaffolding. When blood pressure pushes against the vessel wall, elastin fibers allow it to expand, absorbing the force, while collagen provides strength to prevent overstretching. Chemically, elastin's unique protein structure, with flexible cross-linked chains, lets it stretch and recoil without breaking. High blood pressure increases tension, stretching these fibers more, but if the pressure's too intense, or the wall's weakened like from atherosclerosis or chronic hypertension, the elastin and collagen can degrade, lose elasticity, or tear, raising the risk of rupture and a hemorrhagic stroke. Want to focus on what weakens these fibers or something else?
That's okay. Now, explain us compressive, tensile, and shear force in a couple of words, really nice and simply.
Compressive force squeezes vessels, reducing volume. Tensile force stretches vessel walls outward. Shear force slides blood against walls, causing friction.
Okay. And now, let's talk a bit about compliance and recoil. And this helps us understand how and why vessels would burst and would lead to cardiovascular system failure.
Compliance is how stretchy a blood vessel is, allowing it to expand under pressure like a flexible balloon, while recoil is its ability to snap back to shape thanks to elastin in the walls. High compliance helps vessels handle blood pressure without tearing, but if vessels lose compliance, say from atherosclerosis or chronic hypertension, they become stiff, increasing tension and rupture risk, contributing to hemorrhagic stroke or cardiovascular failure.
Okay, I want to focus a bit more just for a sec, because out of pure interest. So, if something stretches, do bonds break in the molecules? What's going on? Do molecules become more spread out? How does the chemistry change?
When a blood vessel stretches, the bonds in the molecules, like elastin and collagen, don't typically break. Instead, the protein fibers themselves unfold or slide apart, allowing the vessel wall to expand. Elastin's flexible, cross-linked structure lets it stretch like a spring, with molecular chains moving apart, but staying intact due to strong covalent bonds.
What about in something like an elastic band?
When an elastic band stretches, the polymer molecules, usually long chains of rubber-like materials such as polyisoprene, don't break their chemical bonds. Instead, the tangled chains unfold and straighten out, allowing the material to extend, while weak intermolecular forces, like van der Waals interactions, stretch but hold the structure together, enabling the band to snap back when released.
Okay, that makes a lot of sense. And now, let's talk about turbulence, or whatever the fuck it's called. Sorry, guys. Laminar flow. Explain us laminar flow. Explain us junctions, mixing, obstacles, and how this relates to the failure of the CS.
All right, let's dive into blood flow and how it ties to cardiovascular system, CS, failure. Laminar flow is when blood moves smoothly in layers, like a calm stream, with minimal resistance and healthy, straight vessels, keeping stress on vessel walls low. Turbulent flow, on the other hand, is chaotic, like water swirling over rocks, often caused by obstacles like atherosclerotic plaques, narrow vessels, or bifurcations, junctions where vessels split. These disruptions create eddies and uneven pressure, increasing shear stress and tension on vessel walls, which can weaken them over time, raising the risk of rupture or clot formation. In the cardiovascular system, turbulent flow at junctions, often due to plaque buildup, can damage endothelial cells, promote clots leading to ischemic stroke, or stress weakened vessels, contributing to hemorrhagic stroke, both causing system failure by blocking blood flow or causing leaks. Want to zoom in on how this affects a specific part of the system?
Well, before we go to acute myocardial infarction, I want to talk about the endothelium. So, what does the endothelium do? What is it? How does it regulate blood vessel tone? What is tone, anyway? Talk to me about vasodilation and nitric oxide and how it connects to the endothelium. Fluid filtration. Talk to me about the blood-brain barrier, cerebrospinal fluid. What does the endothelium do to maintain hemostasis? What does it do regarding white cells? And talk to me about what does it do regarding angiogenesis, hormone trafficking. Yeah, it's doing a lot of stuff. It's almost hard to remember that it does all these things. And how do all these things relate with cardiovascular failure?
All right, let's tackle the endothelium and its many roles in a concise way, tying it to cardiovascular failure. The endothelium is a thin layer of cells lining blood vessels, acting like a gatekeeper to regulate blood flow and vessel health. It controls vessel tone, how constricted or relaxed a vessel is, through vasodilation, triggered by nitric oxide, NO, which it releases to relax smooth muscle, widen vessels, and improve blood flow. It manages fluid filtration by balancing fluid movement across vessel walls, preventing edema, and in the brain, it forms the tight blood-brain barrier to protect cerebral spinal fluid and regulate what enters the brain. The endothelium maintains hemostasis by releasing anti-clotting factors like prostacyclin to prevent unwanted clots and promotes clotting when needed. It also guides white blood cells to inflammation sites by expressing adhesion molecules, aiding immune response. For angiogenesis, it triggers new vessel growth by releasing growth factors like VEGF when tissues need more blood supply. Hormone trafficking, it helps transport hormones by regulating vessel permeability and signaling. If the endothelium gets damaged, say from high blood pressure, atherosclerosis, or turbulent flow, it fails at these jobs. Impaired NO production narrows vessels, raising pressure and strain, contributing to heart failure or stroke. Faulty filtration causes swelling, disrupting circulation. A leaky blood-brain barrier can lead to brain damage and strokes. Poor hemostasis regulation risks clots, ischemic stroke, or bleeding, hemorrhagic stroke. Weakened angiogenesis or immune response can worsen tissue damage, and messed up hormone trafficking disrupts metabolic balance, all pushing the cardiovascular system toward failure by compromising blood flow and vessel integrity.
Okay,
Want me to dive deeper?
let's talk about acute myocardial infarctions. Now, explain what they are and explain how something like atherosclerosis or coronary artery disease might cause it. Yeah.
An acute myocardial infarction or heart attack happens when blood flow to a part of the heart muscle is blocked, causing tissue damage due to lack of oxygen. Atherosclerosis, a key feature of coronary artery disease, causes it by building up plaques, fatty deposits of cholesterol, and other substances in the coronary arteries. These plaques can narrow the arteries, reducing blood flow, or rupture, forming a clot that completely blocks the artery. This starves the heart muscle of oxygen, leading to cell death and potentially heart failure or arrhythmias. Want me to focus on symptoms or treatments next?
Well, I want us to talk about the process of plaque rupturing. So explain to us what a fibrous cup is and, what's a thrombus, what's an atheromatous plaque, what's the stages of kind of this formation of the plaque.
down plaque rupture and atherosclerosis. An atheromatous plaque is a buildup of cholesterol, fats, calcium, and immune cells in an artery wall, forming a fatty core. The fibrous cap is a tough layer of connective tissue, mainly collagen, covering the plaque to stabilize it. A thrombus is a blood clot that forms when the fibrous cap ruptures, exposing the plaque's core, which triggers clotting proteins to form a clot that can block the artery. Plaque formation starts with endothelium damage from high blood pressure or inflammation, leading to fat and cholesterol accumulation in the artery wall. Macrophages eat up the cholesterol, forming foam cells, creating a fatty streak. Over time, smooth muscle cells migrate, forming the fibrous cap, and the plaque grows, potentially becoming unstable if the cap thins or the core gets too large. Rupture happens when the cap breaks under stress, like high blood pressure or inflammation, forming a thrombus that can block blood flow, causing a heart attack or stroke. Want me to dive into what makes a plaque unstable or connect this to symptoms?
I want to ask you about myocardial infarction. So why do we have increase in sympathetic activity? Why does the nervous system release adrenaline and noradrenaline? What's the difference between adrenaline and noradrenaline anyway? Yeah.
During a myocardial infarction or heart attack, increased sympathetic activity kicks in as the body's stress response to the heart's reduced blood flow and oxygen shortage. The nervous system releases adrenaline, epinephrine, and norepinephrine to boost heart rate, contractility, and blood pressure, trying to compensate for the heart's impaired ability to pump blood effectively. Adrenaline, released mainly from the adrenal glands, acts systemically to increase heart rate and dilate blood vessels and muscles, preparing the body for a fight-or-flight response. Noradrenaline, mostly released from sympathetic nerve endings, focuses on constricting blood vessels and raising blood pressure to maintain perfusion to vital organs. Both are catecholamines, but adrenaline has a broader, more rapid effect, while noradrenaline's action is more localized to vascular tone. This surge can worsen the heart's stress by increasing its oxygen demand, potentially aggravating the infarction if blood flow isn't restored. Want me to tie this to specific symptoms or treatments?
I want to ask you now about pulmonary edema. So this fluid accumulation in the lungs. So what does transudate mean? And tell me about left and right heart failure, and tell me about the symptoms we might have, such as orthopnea. What's orthopnea? Link it also to ascites and peripheral edema. Explain us what that is, why it happens.
Pulmonary edema is fluid buildup in the lungs' air sacs, often tied to heart failure, making breathing difficult. Transient means it can come and go, often triggered by acute events like a heart attack. Left heart failure causes pulmonary edema because the left ventricle can't pump blood effectively, leading to backup into the lungs, forcing fluid into the air sacs. Right heart failure causes blood to back up in the body's veins, leading to ascites, fluid in the abdominal cavity, and peripheral edema, swelling in legs and arms as fluid leaks into tissues. Orthopnea is difficulty breathing when lying flat, a symptom of pulmonary edema, as fluid shifts worsen lung congestion. Sitting up eases it. These conditions stem from increased pressure in veins due to the heart's inability to pump efficiently, causing fluid to leak out and leading to cardiovascular system strain or failure. Want to dive into treatments or specific causes?
I'd like to ask you a bit about orthopnea. I don't understand it. And also about compensation and decompensation.
All right, let's clarify orthopnea and then tackle compensation and decompensation, keeping it concise for the podcast. Orthopnea is when someone struggles to breathe while lying flat, often due to heart failure, causing pulmonary edema. Fluid in the lungs worsens when lying down because gravity pulls more blood to the chest, increasing lung congestion. Sitting up or elevating the head relieves it by reducing pressure on the lungs. Compensation is the body's attempt to counteract heart failure, like increasing heart rate or constricting blood vessels via sympathetic activity, adrenaline and noradrenaline, to maintain blood flow. Decompensation happens when these mechanisms fail, leading to worsening symptoms like severe shortness of breath, fatigue, or swelling, ascites, peripheral edema, as the heart can't keep up, pushing the cardiovascular system toward failure. Want to explore symptoms further or move to treatments?
Let's talk about cardiac remodeling now. So this is basically can be a few things maybe. So the cardiac muscle can grow, change shape, change size, and this is caused by injury basically. Explain us cardiac remodeling.
Cardiac remodeling is when the heart changes its size, shape, or structure in response to stress or injury, like after a heart attack, chronic high blood pressure, or heart failure. It involves the heart muscle growing thicker, hypertrophy, dilating, or developing scar tissue, often as the body tries to compensate for reduced pumping ability or increased workload. For example, after a myocardial infarction, damaged areas may scar and the heart may enlarge to maintain blood flow, but over time, this can weaken the heart, worsen function, and lead to failure. These changes are driven by mechanical stress, inflammation, and hormonal signals like adrenaline or angiotensin II. Want me to focus on specific causes or effects of remodeling?
Well, can ACE inhibitors or spironolactone cause cardiac remodeling?
ACE inhibitors and spironolactone don't cause cardiac remodeling. They actually help prevent or reverse it. ACE inhibitors, like lisinopril, block angiotensin II, a hormone that drives heart muscle hypertrophy and fibrosis, reducing stress on the heart and slowing harmful remodeling after injuries like a heart attack. Spironolactone, an aldosterone antagonist, reduces fluid retention and fibrosis, which can otherwise stiffen the heart and worsen remodeling in heart failure. Both drugs ease the heart's workload, helping maintain better structure and function, countering the pathological changes of remodeling. Want me to dig into how these drugs work or their effects on heart failure symptoms?
I would like to ask you about ventricular hypertrophy. Tell me about eccentric and concentric remodeling, and how come eccentric means dilating due to volume overload, whereas concentric remodeling means thickening due to pressure overload.
Ventricular hypertrophy is when the heart's ventricles grow larger or thicker due to increased stress, often tied to cardiac remodeling. Eccentric hypertrophy happens when the ventricle dilates, meaning it stretches and enlarges, usually from volume overload, like in heart failure or valve issues, where the heart handles too much blood, causing the walls to thin and the chamber to widen. Concentric hypertrophy is when the ventricle walls thicken, often due to pressure overload, like from high blood pressure or aortic stenosis, where the heart pumps against resistance, bulking up the muscle without much dilation. The terms come from the geometry. Eccentric involves stretching outward, adding more volume to the chamber, while concentric involves thickening inward, reducing chamber size but increasing wall mass. These changes strain the heart, potentially leading to failure if untreated.
That makes a lot of sense. And let's talk a bit about heart failure. So, we have a low output, basically, a low cardiac output. Tell us what heart failure is.
Heart failure is when the heart can't pump enough blood to meet the body's needs, leading to low cardiac output. This causes symptoms like fatigue, shortness of breath, and fluid buildup, as organs don't get enough oxygen-rich blood. It can stem from weakened heart muscle, like after a heart attack, stiffening from high blood pressure, or valve problems, reducing the heart's ability to circulate blood effectively. Want me to focus on types of heart failure or specific causes?
Yeah, I want to understand left side and right side.
All right, let's break down left-sided and right-sided heart failure. Left-sided heart failure happens when the left ventricle can't pump blood effectively into the body, causing blood to back up into the lungs, leading to pulmonary edema and symptoms like shortness of breath or orthopnea. Right-sided heart failure occurs when the right ventricle struggles to pump blood to the lungs, causing blood to back up in the body's veins, resulting in peripheral edema, swollen legs, or ascites, abdominal fluid. Left-sided failure often stems from high blood pressure or heart attacks, while right-sided failure is commonly caused by lung issues or left-sided failure overloading the right heart. Both reduce cardiac output, straining the cardiovascular system. Want to dive into symptoms or treatments for these?
Well, so left side heart failure is pulmonary, right side is systemic. Okay, and so what are some symptoms and signs of heart failure? Perhaps fatigue, peripheral edema, dyspnea, paroxysmal nocturnal dyspnea. Explain what these weird words are.
All right, let's dive into the symptoms and signs of heart failure, explaining those terms clearly. Heart failure, whether left-sided or right-sided, means the heart isn't pumping blood well, leading to specific symptoms. Fatigue happens because low cardiac output means less oxygen reaches muscles and organs, leaving you drained. Peripheral edema is swelling, usually in the legs or ankles, caused by right-sided failure where blood backs up in veins, leaking fluid into tissues. Dyspnea is shortness of breath, often from left-sided failure, where blood backs up into the lungs, causing fluid buildup, pulmonary edema, that makes breathing tough. Paroxysmal nocturnal dyspnea is a fancy term for sudden, severe shortness of breath at night, forcing you to sit up or wake up gasping. It's tied to left-sided failure, as fluid shifts in the lungs when lying flat. These symptoms show how heart failure disrupts blood flow, starving tissues of oxygen or causing fluid overload, worsening cardiac strain.
Okay, so what's cardiogenic shock and why does it progress by positive feedback?
Cardiogenic shock is when the heart fails to pump enough blood to meet the body's needs, leading to dangerously low blood pressure and organ failure. It's often triggered by a severe heart attack or advanced heart failure, where damaged heart muscle drastically reduces cardiac output. The positive feedback loop happens because low output starves organs of oxygen, weakening the heart further, which worsens blood flow and spirals into more damage. For example, low blood pressure triggers sympathetic activation, like adrenaline, but this increases the heart's oxygen demand, stressing it more, accelerating failure. Want me to dive into specific triggers or treatments?
I want to ask you about the treatments now of chronic heart failure, and tell us about homeostasis, how we will bring back our body to homeostasis, and yeah.
All right, let's tackle treatments for chronic heart failure and how they help restore homeostasis, keeping it concise. Chronic heart failure, where the heart struggles to pump enough blood long-term, disrupts homeostasis by causing low oxygen delivery, fluid buildup, and organ stress. Treatments aim to improve heart function and balance the body's systems. ACE inhibitors, like lisinopril, lower blood pressure and reduce heart strain by blocking angiotensin II, easing fluid retention. Beta blockers, like metoprolol, slow heart rate and reduce workload, stabilizing cardiac output. Diuretics, like furosemide, remove excess fluid to prevent pulmonary edema or peripheral swelling, restoring fluid balance. Spironolactone reduces fibrosis and fluid overload. In some cases, devices like pacemakers or implantable defibrillators regulate heart rhythm. These treatments boost blood flow, reduce symptoms like dyspnea, and help maintain stable blood pressure and fluid levels, bringing the body closer to homeostasis by ensuring organs get enough oxygen and waste is cleared. Want me to focus on one treatment or specific symptoms they address?
That's great. I want you in one sentence to tell us, if someone had to extract one thing that they learned from this podcast, you have 30 seconds to tell me what it would be.
The key takeaway is that cardiovascular failure, like heart failure or stroke, occurs when the heart or blood vessels can't deliver enough oxygen-rich blood, causing symptoms like shortness of breath or swelling. But treatments like ACE inhibitors and diuretics can help restore balance and prevent worsening.
Thanks for watching, guys. Peace.